Hey, gang. I want to talk to you a little bit about hypoglycemia. And I'm saying it that way, hypoglycemia, because it's the opposite of hyperglycemia. Hyperglycemia is high blood sugar. Hypoglycemia is low blood sugar. And this is primarily a concern for our diabetic clients, particularly those who are taking medications that are designed to lower their blood sugar. And so it's important for you to know, however, that there are other conditions that can cause hypoglycemia. And you've probably, hopefully, have asked some of these questions in your intake form. And I'm going to have to read this to you because I think that the Mayo Clinic says it best. And so this can apply to anybody, not just those who are taking medications, right? So severe liver illness, such as severe hepatitis or cirrhosis, severe infection, kidney disease, and advanced heart disease can cause hypoglycemia. And in terms of kidney disease, of course, with diabetes, we know that kidneys can be a problem. That's what dialysis is, right? External kidney function. But if a person's taking a lot of medications over a very long period of time and the body's not cleaning those medications out very well, the kidneys can suffer from that. And so hypoglycemia can happen really to anybody, although honestly, people who are not diabetic, not testing as diabetic or pre-diabetic, those who are not taking medications are at a significantly reduced risk because there's no reason why the body shouldn't function. But if your clients have these conditions like the kidney disease or the severe liver disease, cirrhosis, you kind of want to be careful about that. And even if they're not diabetic, you might ask them to test their blood. Now, if they are overweight, chances are their doctor has tested their blood, both fasting blood glucose and A1C, because what happens when a doctor sees one or more of those symptoms that are associated with metabolic syndrome or metabolic disease, I don't call it syndrome, you know why, but metabolic disease, then they will begin testing for blood sugar. Of course, the hypo, sorry, um, of course, hyperinsulinemia can precede a diagnosis of diabetes by some upwards of 10 years. But hyperglycemia, that's the high level, not glycemia, hyperinsulinemia, that's the insulin that's too high, is not seen as a problem really with doctors, and they don't test for it routinely. And if they did, they couldn't do anything about it because you can't treat that except with diet, which is what we're doing. So hypoglycemia is actually a very dangerous condition. Very often, people who are diabetic will be prescribed glucose pills and be told to test their blood for this condition if their blood glucose drops. And they've been told things like if they experience hypoglycemia and the condition does not respond well to basically taking something that will raise their blood sugar, eat something that will take their blood sugar, juice or something like that, you that they have to go to the hospital because hypoglycemia can actually be fatal. In fact, speaking of fatalities, I've read a whole bunch of murder mysteries and in true crime stories as well, where the murderer actually used injected insulin to lower the blood sugar of their victims so much that they die. All right, so now you know it's serious, right? And you know that not only diabetics are the ones, although they are the biggest group. The people who are taking medications that will lower their blood sugar or theoretically keep their blood sugar low are susceptible to hypoglycemia. And indeed, I want you to know that our protocols in this process are like adding particularly the extension of the natural fast, and most importantly, even more importantly, is the cutting of carbohydrates, which we'll get to when we talk later. But those are the two aspects that can actually affect. It's like taking an extra medication. And so clients should speak to their doctors. They should talk about the potentiality of hypoglycemia, and particularly if they have any of these liver or kidney diseases, that they should pay attention to this. And like I said, I would go as far, a client who had kidney issues or hepatitis, severe hepatitis, or a severe infection, and I might not know about those, but this comes out in talking, and anybody who has liver disease, I might suggest that they test their blood. It can't hurt. And you could go to, say, for example, Walmart, and for at least the last time I bought them, about $50, maybe because of inflation, it's up a little bit by now, but about $50, you could buy the monitor, the thing to prick your finger, and the sticks, the little tabs, for about $50. And I've had at least one client agree that they should test their blood and to do so. Granted, it doesn't last very long. Once we know that they're okay, it kind of stops. But I've even considered laying in a little supply of those and letting them borrow them. And that may someday, I don't know. I mean, $50, they're paying me, more than $2,000 to do this program. So, anyway. All right. So let's talk really about the symptoms of glycemia. And I'm going to oversimplify this at first. And in the study guide, I have actually copied and pasted something from the internet that gives you the list of, I have to find that list again so I could cite it. But anyway, well, maybe I'll just rewrite it. I don't know. We'll see, because they're well known. Anyway, so a couple of weeks into my program, when I was doing it myself, I was just sort of feeling my way through, and I was testing my blood actually 10 times a day. Now, I want you to know this. I was using every finger every day, and that's how I knew how many times I was testing my blood. I would start off with one finger and go to the next and to the next until I used them all. Well, one night, something woke me up. I don't know, was it the universe woke me up, or did I just have to pee? I don't know. I don't remember. I just remember waking up and thinking how weird I felt. I was disoriented, like, where am I? And of course, you could have that from a dream, right? You wake up and you think you're 7 years old in your old house, and it happens. But this wasn't that. I was disoriented. I felt uncomfortable. I felt not well. I felt distinctly odd. Wow. And so out of curiosity, I tested my blood, and the test came out at 62. 62. That's really low. That's really quite low. Some websites say the danger begins at 57, but really, within a point or two, how accurate are those home meters? And I'm not breeding discontent or lack of trust. What I am saying is when it's critical, pay attention, right? So 62 is really low for me, and it is also really low for science. And so I ate some, I think it was candied pineapple. We had that in the house. My husband likes that. And we don't always keep it, but we had some and I ate that. And I felt better. I went back to bed. And the next morning, I opted, to cut my sulfonylurea in half. And when we talk about medications in a video or two, you'll know why I chose that one. But I cut the sulfonylurea in half because it can lower your blood sugar. And there was a little sort of hump, like it went up a little bit, but then it came right back down, over a few days within another week or so, I had another one of those episodes, although I didn't let it go as low. I was awake when it happened, if I recall correctly. I was awake when it happened. And I remember feeling creepy and feeling like I was coming down with something and not really being clear. And because I was testing my blood 10 times a day, I saw that it was quite low. And it was probably, I don't remember what it was, but it was either the low 70s or the high 60s. And I, at that point, opted out of the sulfonylurea altogether. Now, I do not encourage my clients to make decisions about their medications on their own. I'm confessing this to you and telling you that I realized at the time I was taking my life into my own hands, and that I, and only I, was responsible for the decisions that I made. And eventually, a couple of weeks later, when I looked up what metformin does, I stopped taking that too. But we'll talk about that when we get to medications. The point is that there are a lot of symptoms for hypoglycemia. Your clients, particularly the ones at risk, should know what they are. And I'm just going to read you the list. And I don't remember where this comes from. I'm going to try to find it so I can just leave it in there. The easy symptoms or the earlier symptoms are excessive sweating, tiredness, lightheadedness, feeling dizzy and weak, being pale, losing your color, a sudden feeling of excess hunger, increased heart rate, blurred vision, confusion, irritability, and nervousness. During sleep, having nightmares, crying in the sleep, excessive sweating, enough to dampen the sheets. We used to call those night sweats when I was working in the AIDS world. Feeling tired, irritated, or confused after waking up. And that's what happened to me. I mean, I was confused when I woke up. I just felt distinctly odd. Now, it can get more serious, and it can result, hypoglycemia can result in convulsions, seizures, delirium, and fainting. And there were a couple of times that I fainted, but not because of hypoglycemia, but because I was still taking my blood pressure medications. And of course, blood pressure is one of the symptoms of metabolic disease. And so with some extra exertion, my blood pressure dropped and I sort of passed out briefly. And I think basically laying down, because I fell down, helped my blood pressure come back up. I don't know. I can't say. I don't know. I was not home. I was in my garden or coming home from it when that happened. And I remember just dropping. So anyway, I don't need to talk to you about that. Really, it's about hypoglycemia. Know what the causes might be, especially medications. And when we talk about medications, we'll talk about them in greater detail, especially diabetes medications or any medication. You know, when you're working with medications, clients who are taking medications, you should actually take the time to look up, even if it's just online, what does lisinopril do in the body? Or what does Prilosec do in the body? What does Prozac do in the body or in the brain? Those are things you should be looking up, because sometimes clients will list medications and not tell you what they were prescribed for. And if you happen to have someone with psychosis in your practice, there are real limits as to what you can or should do with that client. And we should be aware of that. I'm not going to go into that here. It's beyond the scope of this training. But anyway, hypoglycemia, not hyperglycemia, hypoglycemia. Pay attention to it, be aware of it, and make sure your clients are aware of it as well.